don't want to go to the dentist, not necessarily because of the dental procedure itself, but because of the interaction with an aggressive, authoritarian kind of dentist. They're afraid that this dentist will push them to all kinds of treatments they don't want to, or that the dentist will say something that will make them feel bad about themselves. For example, how bad their teeth are. It is true that dentistry has dramatically changed over the years, not only technology-wise, but also on how dentists talk with their patients. If in the past, up until 40 years ago, the dentist was the absolute authority and the patient had to silently obey, these days it's completely different. First of all, because of internet, patients are much more knowledgeable about the state of their teeth and they know what they want. Secondly, there are more regulations and laws that protect patients' rights. And thirdly, because of social media and online reviews, dentists are incentivized to keep their patients happy. But still, having said that, many patients find it intimidating to encounter an aggressive dentist. The main reason for that is the power imbalance in the relationship between the patient and the dentist. The patient is the weaker side and the dentist is the stronger side, and patients are afraid of power abuse. Or in simple words, they don't trust the dentist. There is another factor, and that is the fact that a visit to the dental office is very stressful. And what happens to our body in times of stress, that most of the blood goes to the external muscles and less blood goes to the brain. So we can't think clearly when we're really stressed. And that makes us more vulnerable to whatever may sound criticism or negativity, even if the dentist has good intentions. So how can we balance a little bit this power imbalance while we're feeling stressed? First of all, it's very legitimate to say to the dentist before the appointment starts, please be gentle with me. I don't need to hear criticism. It's already difficult for me to come here and I need from you support. And if it's too difficult to say that face to face, you can write an email before the appointment. Whatever you have to say or write, keep it short and to the point. This way, you show respect to the dentist's time and your message has stronger impact. Secondly, you can bring a companion with you to the treatment room, someone you feel comfortable with, someone you trust, someone you can share the emotional burden of this stressful situation. And what's more important, the fact that there is another pair of eyes looking at what is happening in the treatment room changes the dynamics in the treatment room, because the dentist will have the impression someone is observing their work. I strongly recommend that this companion will say nothing. Many people that come along patients have the urge to say something, to help, to interfere, but it only does harm to your connection with the dentist. Thirdly, if any x-rays are being made, you can ask for those x-rays. First of all, once you pay for them, it's yours, it's your property, so you can have them. And again, it gives the dentist the impression that someone will be observing their work. Fourthly, you can meet your dentist outside the dental office. Meet them for coffee. It may sound like science fiction, but it works. Many online clients of mine who did it say it does wonders, because then you can meet your dentist on a more personal level. And finally, the most effective tool to empower you, the patient, is the ability to choose. If you're able to choose your dentist, what kind of treatment and when, then you will feel you own the situation. So I recommend to first have a dental checkup, get to know this dentist as a person, and then decide whether you want to be treated by them or not. Now, sometimes you can't choose because you have a real dental emergency and you want treatment now. Most dental emergencies are caused by bacteria, meaning dental cavities or gum diseases. And these problems develop very slowly in the course of months, if not years. So if you have a dental emergency and the dentist you see is not to your approval, try to buy some time. A few more days, even a week, won't make much difference to the tooth. The treatment will be the same. And you can buy some time by getting antibiotica or painkillers or shaving off the tooth. Depends on the situation. But don't feel rushed. You can treat the tooth later on properly. The dentist is a service provider. Their job is to improve your quality of life, at least as far as teeth are concerned. Some dentists might oppose to what I'm saying. They would say, we're not service providers, we are doctors, we fight diseases. Well, guess what? Doctors are also medical service providers. And the reason I allow myself to say that is very simple. Dentistry, like medicine, like psychology, is not exact science. They may use scientific tools like statistics and research, but they're not exact science because there is no real objective definition to health. There is no real definition to successful treatment. Or should I say, there are many definitions that change over time, geography, and circumstances. And you can find textbooks that contradict one another because, again, it is not exact science. So the dentist is a service provider, and you are the client, and you deserve to be treated respectfully. For personal advice, book an online consultation on treatyourdentalfear.com.